Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. Now, there's some things that I would like to get accomplished. There's things that are done in orthodontics that really, to my thinking, is wrong, and they are wrong. And so let me start out, and we're going to do a whole series on why pediatric dentists should be doing orthodontics, and it should be taught in the orthodontic schools over the whole world, really. But in many of the universities where they have orthodontic departments, the orthodontists kind of dominate the school. I've had a lot as far as what's taught orthodontically. I've had a lot of wonderful orthodontists that have helped me over the period of time, but the people that run the school, those do not want the pediatric dentist or the pediatric department to know how to do orthodontics and don't want them doing orthodontics. Well, this is wrong, and I'm going to try to show why orthodontics should be taught to everybody that's working on children. I don't care if you're a pediatric dentist or not, and you have children that's your patients, you should know orthodontics. And that's the way I got into orthodontics, was seeing that pediatric or children orthodontics was not being done properly, and I started doing it. And I did this, and I hacked off some orthodontists around close to me, and so they, in order for me to show that I was doing the right thing, I put on a table clinic in a state meeting, and I won that. There were a lot of orthodontists doing this. We did this where we reduce the deciduous teeth and bring the teeth in where you've got a real crowded case like this. And so now I want to back up our decision to make these things. I want to back that up. And so what I'm going to call this is pediatric orthodontics, choosing the right parents. Well, the child can't really pick out what they're going to be, but in the United States, we are a totally mixed up country. I mean, as far as where we came from. And so here in the United States, you will have people that marry, and one of them will have a large, broad facial structure, and the other one might have a narrow facial structure. And the one with the broad facial structure, the child may get the gene from that over and try to put the tooth in the bone structure of the smaller person. Well, it's absolutely stupid to try to put all these teeth in there. But at first, orthodontics didn't know how to deal with extracting teeth. So they said, well, God gave you all these teeth, and you should put them all in your mouth and not worry about it. And you have somebody bulged out, and it looks terrible. So you extract teeth on somebody that has one parent is broad face and bigger. And this happened to me in Africa, and I've got a video on that, how this young lady had that, and the different color of skin gave me the idea on that. So I'm going to start out this morning and show why teeth need to be extracted on some people. Not everybody, but then somebody had a big tooth, putting it in a small facial structure just does not work. And so you extract teeth only in that case. So let's get started, and I'll try to go through this and show you what happens. Here's a young lady, and we call this serial extraction. Now, that means that you can go in here and take teeth out if you do it at the right time and everything, and the person is breathing through their nose. They're not sucking their thumb or doing some bad habit that messes up the teeth, like tongue thrusting and all these other things, which we will try to cover these all. So I'm going to have this real nice little girl, and she is crowded as all get out. Now I'm going to show the models, and those two cuspids are tilted out, and there are permanent teeth trying to get in here. They're trying to put all these teeth up here. Now she's got large central teeth, and you can't get those teeth and laterals and cuspids in between the space here. So let's go now. So we look at this child and look at the parents that the child has. One of them has a big facial structure, and the other one has a smaller structure, and the child has got the tooth of the big one and putting it in the smaller facial structure. And this just makes good sense. And everybody doing children's dentistry ought to know how to do that. So I want to go through and show. We're going to come in here and we're going to take out permanent teeth in through here. And you have to get some baby teeth extra too to solve the problem. I'm going to run through and show you the models right quick. Crowded on both sides of the mouth. They're fairly, the class 1 relation is pretty good. Here this is meeting fairly close to correct. And then look at this, and we're going to try to put all this front stuff in this space between the bicuspids. And it just is too crowded. It'll show up on the x-rays in a minute. All right, so we go through that. So we take out some baby teeth to start with, and then we come in and go get the permanent teeth. We remove teeth here in this case. And stay with me now. This is not for somebody who's just thumbing through here to see something. But people, you want to know how to do orthodontics, you come in, we'll try to show you how to do it, but it's going to take some time. Now, here is the Panorex on this person. I had an old Panorex, and you have them bite together with the Panorex. It'll show these teeth right here meeting correctly in the mouth. The bottom teeth molar should be out in front of the upper molar in here. And then you've got these baby teeth. These are permanent teeth, and these are baby teeth right here. Same thing over on the other side. Now, the second bicuspids, that's these. We're going to hang on to them. Now, you're going to see this cuspid coming in here, and where are you going to stick it? And I know it can be worked out. Down here, we got the permanent cuspid coming in, and here's the permanent lateral is in here, and it's right on top of it. Now we know about follicular movement, and I'm going to talk about that some. It's another thing that needs to be taught and done in orthodontic school, and anybody that's working on kids ought to know what I'm talking about here. And this is 1972. It is a long time ago, but this is true then, it's true now, it'll be true 100 years from now. It doesn't matter. That's not something that's going to go out of business later on. The people are not going to change. So watch me now. See this permanent cuspid coming right up under the lateral. Come right up under. This is a permanent lateral. That's not a baby lateral. And of course, these are permanent laterals too. And these cuspids are headed right into them. All right. And then we have our 12-year molars back in here. And before we really get through this too much, we want to make sure we've got wisdom teeth back at the back of the mouth. Let's go on now to another This x-ray was taken in 4 of 72. Now here is 5 of 73. We took the baby teeth out. Now these first bicuspids have come into the mouth further. And so now we can come in here and look at this and see if I could take this cuspid and put it over here, and this bicuspid, they would just about fill this space right in between here. And so that's what I recommend doing on here. And I don't care where you are, if you're working on children and it's in a mixed area, this happens. Now in Africa, I was working in a group of people that were the same tribal people. They weren't mixed with anyone else, and all the kids' teeth fit their mouth, and I didn't need any orthodontics. But you come in the United States or any European country nowadays, and you've got people from one race to another, or at any different type of people, the teeth don't fit, and when they're too big for the place, it is stupid not to take out some teeth. And these people that are non-extraction, they have to shove all these teeth back here to make room, or else they look so full in the face, it looks bad. All right, I'm going to go down to 73, and we go to 7 of 73, and go back here. Now we're going to take this out, and we're going to take this out right here. Now look at this and study it. If this isn't true, if this is a waste, tell me about it. This is true, and we're going to take this out. All right, let's take it. We remove it in 7 of 73, and this was 5 of 73. Look what happened. This tooth came away from that tooth. This tooth moved this way. This is the follicular movement of the teeth. Now we're going to follow this case through, and I haven't done any orthodontic thing except remove deciduous and permanent teeth that are going to let this move correctly. Now watch, this is 7 of 73, and we go to 1 of 74. So this is several months goes past here. Look at this follicle around here. It is round. Now I'm going to go back where it was. This follicle was round then, except it was squashed down right over by the root of the teeth. When I took this out of the way back in the back, there was no pressure. The follicle will move through the bone structure without any problem. Let's go back one more and I'll show you that. Now, it's way back over here. We want this tooth over here. We want these roots over here. This will push against that. If I relieve the pressure on the back side of the tooth, this tooth will move on its own over this side. Now watch that happen. We take one out, it moves part of the way. We'll take it, and now the space is there. Let's see what it's 7 of 73. We go to 1st of 74. The follicle is rounded out now over here, and it has moved the tooth over. This one is rounded out, that these teeth will go in here. Just look at the x-rays and the panoraxes as we go and watch what happened to the teeth. Now they moved out, so we go to 2 of 75, and now these cuspids are coming in over here at this time, and these teeth have drifted forward just a little bit in here. We see we've got wisdom teeth up here, and we're going to try to get all of this inner mouth if we can. But we'll get these teeth to come in, and I haven't touched this orthodontic. I haven't put any appliances on here. But this is what the pediatric dentist ought to be doing. But if they need to put the appliance, put them up there with ectopic erupting things, they should. Now watch this. It's 2 of 75. Now, here's 8 of 75, and these cuspids are coming in, and here is the second bicuspid coming, and there is the second bicuspid, and these teeth have drifted a little bit to the front, and nature is keeping this open. Now, if you got somebody that's breathing through the mouth, this won't happen this good because you don't have the forces in there. Now, the thing is guiding these teeth into erupting into each other is when you swallow, you push your tongue against them and you bite your teeth together, and that biting together fixes this distance in the chin and the face out here, and the tongue pushes the teeth into the places where they meet one another correctly. And that's what's happened in nature. If somebody's in the same tribe or the same people, father and mother are the same deal, it works out that way. But when you get one parent, doesn't matter if it's the mother or the father, it has a big one, and the other one has a little one, it does not work out. So you can go in and take teeth out on people like that. Now let's go, that's 8 of 75, and we'll see what happens here. Now you see how the baby teeth are over here. This was already gone, that was almost gone, and the tooth erupting here will eat all the inside of the tooth out, but leave the enamel shell. It hits here and you have to push that off. This is coming in, eating the tooth away, coming like that. Watch it. All right, here it is, 7 of 70, 5, let me see, 5 of 77. There's several months has taken place in here. This came in like this, without touching the teeth. And that ought to be taught to everybody that's dealing with children. You can do this on people. Now, this is orthodontics, absolutely the best way in the world to straighten the teeth. We've got somebody that's swallowing correctly, they're breathing correctly, they're doing all these. If you breathe through your mouth, you're going to have these teeth will be wider, and these will fit inside and get it screwed up like that. So you have to deal with a different problem. Now, let's go. This is 4, 5 of 77, and her age, she's 12 years of age at this point. And this has come like this, and I did not do anything except see what needed to be done, and we eliminated some of the teeth. And don't tell me that it's wrong to take the teeth out. This is one of the best ways you can do that. Now, some of these, they aren't going to come out perfect if they're not functioning perfectly fine. It frequently, you'll have that problem. Now, we may or may not have room for the wisdom teeth to come in. But if this young lady grew enough jawbone to come in, this would come up here, and it'll go back, and the teeth will fit in that area. But you're going to have to come out. But on the bottom arch, the teeth come to the inside of the bone structure, and a lot of times they have plenty of room for the wisdom teeth to come in. So this 77, I don't know whether I've got another, I think that's the last x-ray that I took on her, and that was correct enough. Now I'm going to show you the teeth, actually what happens, but if you don't see the x-ray, you can't possibly figure out what's taking place in there. And I'm going to run through that real quick. We got a lot of this stuff to cover, and I don't have a lot of long time to be here. Now, they're going to push this in. Now, we took this out down here, took a tooth out so the cuspid would come in here. And it is wrong to remove the deciduous cuspid on these crowning teeth. And here's a facial structure as we go through. All right, here is 4 of 77, and the teeth have come in the mouth And this is without anything doing. Now, one thing, she wasn't swallowing as good as I would like, so this upper arch is not filling out quite like it ought to be. But you could do this on this person, and if they didn't get to do orthodontics, they still have a nice looking set of teeth. But sometimes we come back and redo this, come back, and this is something you could use your plastic little shells to correct the width of this right here if you wanted to. Anyway, we had done work on her father. We came in and touched this up after we got through with the serial extraction procedure. And now there's 4 of 77. And there's 12 of 77. We came back and touched this up just a little bit. And now this is I think this is the end of it. We've broadened the upper arch out just a little bit and lined that. Down here was like that 12 of 77. It's still not ideal. So we came in and I put some braces on her just to finish it up just a little bit. Now look at the arch. See, I broadened this arch out. Now, if she had been really swallowing absolutely correctly, the tongue should have shoved this out where it should be. And this tooth is back where it is. It's going to go out there. Now the lower arch is lining up. We're going to line that up good. Now there but there was very little of orthodontic putting stuff in their mouth. It had to be done or should be done, but she could have gone her life with the other teeth were looking quite good. And I've done this on missionary kids that couldn't possibly get orthodontics done, and their teeth still look good. Now, so here we finish her up 4 of 79, and the midline's right on. The teeth are broadened and spread out properly. We had to touch it up at the end. But the orthodontics that we did after that was just dead simple. Really easy and can be done in a few months' time, lining that up. So this is 4 of 79. And here we are. Here she's in 1995. Now look, this is 79, 89, and 95. This is a long time's happened. She's been off up in north, got married, came back, and I saw her, and so I got some pictures of her teeth. And she kept that 95 like that. Now that's not perfect. It relapsed a little bit in this area right here. There's the teeth in 95, so this is stable. This, if I had put a bonded 3 to 3 in here, this wouldn't have relapsed here. And there the facial structure after so many years. This is 95. And this is her smile. So, what I'm telling people, have the pediatric departments in the dental schools over the country free to go ahead and do orthodontic things, that they can do this and they can do it better. They do it spotted orthodontic stuff rather than send them over to an orthodontist for little bitty things along the way. Thank you for watching, and I hope to get orthodontic schools in the universities and the dental department where they're doing all this orthodontics everything, all dental work. Orthodontics should be part of what is taught in every dental school, and anybody working on children, where you call yourself a pediatric dentist or not, ought to know how to do this. Thanks for watching, and I hope you'll subscribe to our channel, and I'll see you later. I hope we will, and we're going to try to correct this problem over the whole world. And these videos are sent all over. I don't know who I'm talking to, but I hope that I am talking to the head of some of these pediatric departments of dental schools. Thank you for watching, and I want to say goodbye.